Ankle sprain. Lateral ankle sprain. A sprained ankle is one of the most common injuries to present to an emergency room. Although an injury of this nature may occur on either the inside or outside of the ankle, the lateral ankle sprain, outside, is far more common. The vast majority of people who sustain this type of injury do not seek medical attention, and those that do, in many instances are undertreated. The ankle joint is known as a hinged synovial joint, meaning the motion of the ankle is limited to an up-down motion, also known as dorsiflexion and plantarflexion. The most common form of injury is known as a lateral ankle sprain or inversion sprain. This is where the foot bends inward below the ankle joint. This causes a severe stretching on the outside of the ankle and conversely a jamming effect on the inside of the ankle. An ankle sprain is considered by many doctors to be a partial dislocation of the ankle joint. Severity of ankle sprains. Ankle sprains are graded according to severity. Grade 1 is a minor strain with no tearing of ligaments. Grade 2 is a partial tear of the lateral ankle ligaments. Grade 3 is a full tear of one of the ligaments and possibly even a tear of what is known as the peroneal muscles that run directly underneath the outside of the ankle. Most, if not all, lateral ankle sprains initially may not be too painful, but as the day progresses, so does the pain and swelling. A fairly common occurrence with severe inversion ankle sprains is possible fracture of the fifth metatarsal base. Diagnosing ankle sprains. Once presenting to the doctor or an emergency room, X-rays will be taken. X-rays cannot visualize ligaments or tendons for possible damage, but they are taken to rule out fracture, either to the ankle itself, the fifth metatarsal bone, or to the lower leg. It is important to note that very small cracks in bone may not show up initially on X-ray, but if the patient does not respond in the appropriate period of time for an ankle sprain, additional X-rays or even an MRI may have to be considered to look for small fractures. X-rays on the initial exam are also helpful in recognizing abnormal joint alignment as a result of the sustained trauma. If there is a malalignment of the ankle joint with no fracture, casting may be required to realign the ankle joint, otherwise, the patient may have chronic pain in the ankle. Sometimes surgery is also necessary if the ankle cannot be realigned through manual means. In the majority of cases, initial X-rays will be negative for any bone pathology. Due to the expense involved, an MRI is usually not performed on initial treatment, unless a fracture is suspected and not seen on X-ray. Some institutions may consider doing a diagnostic ultrasound to check the integrity of the ligaments and tendons surrounding the ankle. This is an inexpensive and quick test. Ankle sprain treatment. The treatment protocol for ankle sprains has changed dramatically over the last decade. Years ago, the treatment of choice was rigid immobilization. This meant putting on a cast with the foot in proper alignment to the leg in order to allow the ankle to heal over time. Experience has shown that over-immobilization, particularly in grade 1 and grade 2 sprains, may lead to scar formation in the healing ligaments and tendons and can leave the patient with chronic pain. The only time a cast becomes mandatory is if there is an associated fracture with the ligament damage, or quite simply, the patient cannot bear weight on the foot. The use of crutches and remaining non-weight bearing on the foot would also be introduced at this time. In grade 2 and grade 3 sprains, after about 1 week, the patient may want to start on a regimen of physical therapy. The purpose of which is to help facilitate the healing process, reduce edema, pain, and increase motion in the joint, thus getting the patient healed quicker. Grade 1 ankle sprains are treated a little bit different. Most of you are familiar with R.I.C.E. Rest, ice, compression, elevation. This, along with anti-inflammatory medication, assuming you can tolerate them, is all that is necessary. Within a few days the ankle should feel better and each day should bring further improvement. Read the complete article at www.foot-pain-explained.com/ankle-sprain.html